articulating mandibular casts. Transfer the maxillary model from the axis mounting plate to the articulator, setting the pin to a positive 2.5 to 3.0. This is necessary when articulating with open bite centric registrations. When the open bite centric registration is removed, the models will articulate close to the 0 setting on the pin. If the articulator is a newer model, it can stand on its backside. Older models require the use of a mounting stand to finish relating the casts to one another. Using the mounting stand allows for a secondary pin on the upper member of the articulator to be adjusted. This allows the maxillary cast to stay level when loaded with the CR bite registration and the mandibular cast. The open bite registration allows for one additional benefit. If the casts do not accurately index into the bite registration, the model is inaccurate. Make sure the casts are accurate to the bite registration or do them over. The bite registration is never distorted. Accuracy is critical. Dry mount the mandibular cast and the CR bite, making sure that the pin touches the table. If not, it is necessary to grind the model away until the articulator pin passively closes down on the table. The model is then indexed on the bite registration. Mounting stone is applied to the mounting plate and the model, thus completing the articulation. It is important to use either cast sticks or hold the model in place while the mounting stone sets to assure mounting accuracy. It is critical to observe the teeth resting securely in the indices of the bite registration. Many people inquire as to how to prove the accuracy of hinge axis mountings. How does one know if the joint is stable and the models are mounted on a true hinge axis? The bioaesthetic group of clinicians use the MAGO, or maxillary anterior guided orthotic, adjusted in centric relation over a period of time. When they have adjusted the orthotic to the point where the patient's bite no longer changes, then over a 3-week period, 3 open bite centric registrations are done 1 week apart. These are all accomplished at the same vertical dimension. Those bites are seen here extending horizontally across the scene. At the end of the 3rd week, 3 bites are done on the same day at different verticals. These are seen descending vertically in the scene. If these registrations are done at the end of a 3-week period, then 1 bite can double for both procedures. The clinician can use a condylar position indicator called a CPI or an axis position indicator called an API to verify stability of the joint. The API is less accurate, but it serves very well to determine stable condylar position. Please note the API uses CPI graph paper. Seen here, the API graph shows 2 little dots. In truth, there are 4 bite registrations showing the condylar position on this patient. Also shown in black are 3 bite registrations done on different days at the same vertical dimension, showing the movement of the condyles up and forward on one side and up and back on the other. Both show stability because all 3 bites are in the same position. For illustration purposes, a freeze-frame photo of another case shows in red the initial diagnostic condylar position. This vertical row of centric bite registrations, accomplished at different VDOs or vertical dimension of occlusion, is used to verify the hinge axis location when the hinge axis is accomplished. If the condyles are stable and the models are mounted on the hinge axis, it will not matter what vertical dimension is used with the centric bite registrations. The models will close into each bite accurately without any distortion. This scene demonstrates the clinician testing to see if the 3 bites are accurate with the articulator closing into each bite accurately. All 3 bite registrations match up, proving the accurate hinge axis location with stable condylar position.